Hello everyone, myself Himani Sharma from DMLTD Pharma Department in RPIIT campus. In today class, I discuss about the epigastric pain dental management. If a patient present with the symptom of the epigastric pain as described previously, the dentist should refer this person to the primary care physician for diagnostic workup. Dentists should avoid the administering drugs that exacerbate ulceration and cause the gastrointestinal distress such as the aspirin and other NSAIDs. Instead, the acetaminophen produced should be recommended. Antacids contain calcium, magnesium, and aluminum salt that binds antibiotics such as erythromycins and tetracycline. Dentists should remember that administering one of these drugs within 1 hour of antacids therapy may decrease the absorption of the antibiotics such as 75 to 85%. Erythromycins and tetracycline should be taken 1 hour before or 2 hours after ingestion of antacids. Exogenous steroids administration is likely to exacerbate the ulcer because of the increased production of acid caused by steroid and should be avoided. It's good to prescribe penicillin V instead of penicillin G because of the destruction of penicillin G by gastric acid. Hyposalivations and dry mouth xerostomia are the common complaint in patients taking anticholinergic drugs. Patients who wear either the complete or partial denatures are the particularly troubled by oral dryness. Denature, adhesive and artificial saliva may aid in the retention of their dental prosthesis. Cimetidine and ranitidine drugs commonly prescribed for duodenal ulcer patients have occasionally been associated with the thrombocytopenia and may compete with antibiotic or antifungal medication. Next, the signs and symptoms. Epigastric pain perceived as a burning sensation usually occur when the stomach is empty or when not enough of a meal remains in the stomach. In contrast to the symptoms of duodenal ulcer, the pain of gastric ulcer is aggravated by food, bloating and abdominal fullness, hematemesis when an ulcer perforate and hemorrhages. The patients often vomit gross blood. The blood loss can lead to the iron deficiency anemia, duodenal perforation, which lead to the acute peritonitis melina. In today's class, I discuss about following dental management of the epigastric pain. Thank you for watching.